Welcome back to our discussion on anesthesia CPT guidelines. In this segment, we will be diving deeper into the components we didn't cover in the previous part. Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nishaba, a certified medical coder. Building upon the foundation we established in a previous discussion, let's move forward to cover the remaining portion of anesthesia CPT guidelines. In the previous video, we covered time reporting, anesthesia services, supplied material, and separate or multiple procedures. We also discussed unlisted services and special reports. You can review it to refresh your memory. Let's now begin with anesthesia modifiers. Our next important component of anesthesia guideline is anesthesia modifiers. Understanding anesthesia modifier is crucial for accurately reporting the anesthesia services providing during the procedure. The modifier provide additional information about the level of supervision, involvement of anesthesia providers, and other important details that impact billing and reimbursement. Let's explore the various anesthesia modifiers commonly used in medical billing, their meaning, and when they should be applied. Double A. Anesthesia given by anesthesiologist. 47. Anesthesia given by surgeon. QS. Monitor anesthesia care. It's also known as MAC. G8. MAC in case of complex surgery. G9. MAC in case of severe cardiopulmonary condition. QX. CRNA is directed by physician. QI. CRNA is directed by anesthesiologist. QZ. CRNA without direction. QK. Medical supervision of CRNA less than 4 surgeries. AD. Medical supervision of CRNA greater than 4 surgery. Let's discuss each modifier individually to create an understanding. The modifier AA or AA indicates that the anesthesia services were personally performed by the anesthesiologist. Here is an example of how it might be used. Let's say an anesthesiologist provides anesthesia services for the patient undergoing a surgical procedure. The anesthesiologist personally administers and manages the anesthesia throughout the entire procedure. In this case, the anesthesia service would be reported with the appropriate anesthesia CPT code and the modified AA. It would be appended to indicate that the services were personally performed by the anesthesiologist. Modifier 47. CPT modifier 47 is known as anesthesia by surgeon. It is used when the surgeon administers local or regional anesthesia for a minor surgical procedure in addition to performing the surgical procedure itself. This modifier is used to distinguish the anesthesia service provided by the surgeon from those provided by anesthesiologist or certified registered nurse. Let's take an example. Patient in a remote area required exploration of deep penetrating wound of thigh. The surgeon gave epidural anesthesia and then explored the leg. The answer will be along with the modifier 47. Modifier QS is used to indicate monitor anesthesia care. It is provided by qualified non-physician or a physician. It is for managing the patient's anesthesia care, including assessing the patient's response to anesthesia, adjusting anesthesia level as necessary, and providing any necessary interventions to maintain the patient's comfort and safety. Here is an example of how modifier QS might be used. Let's say a patient is going under a minor surgical procedure and requires MAC anesthesia. The physician administering the MAC anesthesia continuously monitors the patient's vital signs, administers sedation as needed to keep the patient comfortable and ensure the patient's safety throughout the procedure. The anesthesia service provided during the surgery would be reported with appropriate anesthesia CPT code, and modified QS would be appended to indicate that monitor anesthesia care was provided by a physician. Modifier G8. Modifier G8 is used to indicate that monitor anesthesia care was provided for a complex surgical procedure. MAC for complex surgery involves a high level of anesthesia monitoring and management due to complexity of surgical procedure and potential patient risk. Here is an example of how modified G8 might be used. Let's say a patient undergoes a complex surgical procedure and required monitor anesthesia care due to the nature of procedure and potential risk involved. During the surgery, the anesthesia provider continuously monitors the patient's vital signs, administers sedation and analgesia as needed, and ensure patient's comfort and safety throughout the procedure. The anesthesia service provided during the surgery would be reported with appropriate anesthesia CPT code, and modified GAD would be appended to indicate that the monitor anesthesia care was provided for a complex surgical procedure. Modify G9. Modify G9 is used to indicate that the monitor anesthesia care was provided for a patient with a severe cardiopulmonary condition. Make for such condition involved specialized anesthesia monitoring and management to ensure the safety and well-being of patient with significant cardiovascular or respiratory issues. Here is an example of how modified GNITE might be used. Let's say a patient requires a surgical procedure but has a severe cardiopulmonary condition such as severe chronic obstructive pulmonary disease. Due to the patient's cardiopulmonary condition, the anesthesia provider needs to carefully monitor the patient's cardiovascular and respiratory status throughout the procedure to reduce any potential risk. The anesthesia service provided during the surgery would be reported with an appropriate anesthesia CPT code, and modified G9 will be appended to indicate that the monitored anesthesia care was provided for a patient with a severe cardiopulmonary condition. Modifier QX. Modifier QX is used to indicate that CRNA provided anesthesia services under the medical direction of a physician. Here is an example of how modifier QX might be used. Let's say a patient undergoes a surgical procedure and anesthesia services was provided by a CRNA under the medical direction of a physician. The physician medically directs the CRNA who administer anesthesia to the patient. The anesthesia service provided during the surgical procedure would be reported with the appropriate anesthesia CPT code and a modifier QX. It indicates that the anesthesia service was provided by CRNA under medical direction by a physician. Modifier QY. Modifier QY is used to indicate that CRNA provided anesthesia service under the medical direction of an anesthesiologist. Here is an example of how modifier QY might be used. Let's say a patient undergoes a surgical procedure and anesthesia services are provided by a CRNA under the medical direction of anesthesiologist. The anesthesiologist medically directs the CRNA who administer anesthesia to the patient. The anesthesia service provided during the surgical procedure would be reported with appropriate anesthesia CPT code and modifier QI. It indicates that the anesthesia service was provided by CRNA under the medical direction of anesthesiologist. Modifier QZ. Modifier QZ is used to indicate that CRNA provided anesthesia services without medical direction by a physician or anesthesiologist. This means the CRNA administered anesthesia independently without supervision or direction from a physician. Here is an example of how modifier QZ might be used. Let's say a patient undergoes a surgical procedure and anesthesia services are provided by a CRNA without medical direction from a physician or anesthesiologist. The CRNA independently administers anesthesia to the patient. The anesthesia service provided during the surgical procedure would be reported with an appropriate anesthesia CPT code, and modified QZ would be appended to indicate that the anesthesia service was provided by a CRNA without medical direction. Modifier QK. The modifier QK is used when the anesthesiologist medically directs 2 to 4 concurrent anesthesial procedures. Here is an example of how modifier QK might be used. A patient undergoes a surgical procedure and anesthesia services are provided by a CRNA under the medical direction of an anesthesiologist overseeing 4 concurrent procedures. The anesthesia service provided during the surgical procedure would be reported with appropriate CPT code, and modifier QK would be appended to indicate that anesthesia service was provided by a CRNA under the medical direction of anesthesiologist overseeing 4 concurrent procedures. Modifier AD. The modifier AD is reported when the anesthesiologist medically direct more than 4 concurrent anesthesia procedure. Here is an example of how modifier AD might be used. A patient undergoes a surgical procedure and anesthesia services are provided by CRNA under the medical direction of anesthesiologist overseeing more than 4 concurrent procedures. The anesthesia service provided during the surgical procedure would be reported with appropriate anesthesia CPT code and modifier AD. It indicates that the anesthesia service was provided by CRNA under the medical direction of anesthesiologist overseeing more than 4 concurrent anesthesial procedures. In the next video, we will cover the remaining components of CPT anesthesia guidelines. If you have any question or need further clarification, feel free to ask in the comment section or reach out via email. Thank you for watching. If you enjoyed the video, please like, share it. Your support means a lot to me. If you haven't already, consider subscribing for more. Click the bell icon to receive notifications. For more detailed guidelines, CPC mock or exam related questions and notes, email me at my given email ID.